fourth medical emergency, airway or breathing problems. There are four categories of disorders that I will talk about in this video. The first category is asthma. People with asthma, when they get an infection or when they get into the winter months, they begin to suffer an exacerbation of their condition. Despite using their inhalers or their medication, they begin to experience a worsening or deterioration in their condition and in their breathing. When you see these people, please take them immediately to the hospital because they will deteriorate. The second category of people are people who have COPD. So COPD is an acronym for chronic obstructive pulmonary disorder. Common in smokers, they also experience an exacerbation of their condition. Despite using inhalers and medication, they suffer an exacerbation and they need to come into the hospital when they begin to get short on breath and they are unable to breathe. When they're unable to breathe, they begin to retain carbon dioxide instead of letting it out, and they can deteriorate further. The third category of people are people who are choking. If you can't get help in dislodging whatever is blocking the airway, make sure you get emergency services involved as soon as possible because they have literally less than 6 minutes before they go into a cardiac arrest and potentially die. The fourth category of people are people with epilepsy or people who experience seizures. So people experiencing seizures, they usually will take their medication, but when the medications are not working, they get the seizures back to back to back. When the seizures are happening back to back, there is a period of apnea, which means they are not breathing or they are not getting oxygen. This is very dangerous. As soon as the seizures are not terminating with the medication, please bring them into the hospital immediately or get the emergency services involved. Remember, we aim to explore, to expatiate, and to educate.